Bine ați venit! Vă mulțumesc și mă onorează prezența voastră la invitația noastră. Este un eveniment mic în care punem accent pe calitatea informației și, desigur, pe invitații de onoare pe care îi avem astăzi aici. Și doresc să vi prezint. Daniela Bițică este manager biroul Iași Acibadem. Ana Hertman, manager România Acibadem. Domnul doctor, o să vă rog, please, can you do the presentation for yourself?
Nice to meet you. I'm Dr. Cenk Ersenis from Taksim, Istanbul. I'm very pleased to be here.
Și astăzi o să discutăm câteva aspecte generale, spun eu, câteva informații de ordin general despre check-up-ul de investigații pe care îl fac cei de la Acibadem și, desigur, despre activitățile noastre zilnice cu care ne confruntăm și care ne aduc, din păcate, nu numai vești bune. Ok. You can start the presentation.
Thank you, Anna Maria.
Welcome.
Very pleased. Again, I am very pleased to have nice people like you here. I'm going to give a small presentation, not to bore you too much on this Sunday afternoon. So, vorbit engleză este un problemă? Okay. So, our hospital is located at the very center of Istanbul, Taksim. And it's very easy to go by all means if you ever land in Istanbul. It is a small hospital, around 24,000 meters square. It's one of the smallest of Acibadem group. You know, we have a group of 25 hospitals all around Turkey, and there are 11 hospitals in Istanbul. So, I am in charge of checkup section, departments, and I do the checkup programs for people over 16 age. So I am responsible for every patient who is over 16 years of age, and before that age or under this age, our pediatrics just take over this process if anybody wants to do the checkup programs for the children. So we have this number of rooms, this number of departments. I'm not going to bore you with those information, but when we have these departments at the 11 hospitals around Istanbul, if there is any problem medically detected, I can have all my patients see every kind of specialist and every kind of technical capability regarding cancer, chemotherapy, organ transplantation, cardiovascular surgery, whatever comes into your mind, or maybe bone marrow transplantation, anything can be done and achieved within a few days. And I can have the patient be evaluated according to these parameters. So, why checkup programs? Because, you know, when a disaster hurts you or hits you, it is more complicated to cure from the disaster. So we try to find out or detect any kind of problems before the disease comes to you. So that's very valuable information for us. We have two major plans for checkup programs. One is the standard one, and the other one is the executive one. But before I decide about which package I should apply to any patient, I would like to see every patient and evaluate according to their problems. So we can shift from one to another according to their needs. Why it is so focused? Because, you know, our design is a very compact design. So whatever we want to do, we can just accomplish these tests and reach the capabilities within hours and within days. So our standard checkup is designed to be finished within 1 day. When you come in the morning, I evaluate you and I send you to the lab, to the imaging tests, and in the afternoon you see the consultations that are already embedded in this program. And in the afternoon time, after 3 or 4 p.m., everything will be finished for the standard checkup program. The next day, I have the results, reports in my hand, and at the end of the day, we'll be talking about the final conclusion, and we're going to have an algorithm for everything we should do in time. So they are compact, and when a package is both, be sure that when you want to do these tests alone and pick them up one by one, any patient should have to pay 4 or 5 times the price that you're going to pay for a package. So this is very compact and very economic for you. And you're going to save time, of course, because I know in many places around the world, around Europe, where you have to take appointments, but the time spent between the appointments are very far. So you even forget the result of one test before you go to the appointment. So these will be quick, these will be appropriate, and after that, of course, we will just follow you up. We will not leave you, of course. We will follow you up and we'll show the ways to get rid of the problem if you have any. Of course, to have the information that you don't have any problem is priceless. So some people may think that if I don't have any complaints, then why would I do the checkup program? That's the exact time we want you to come to our program without any problems, without any chronic diseases. So it's the most reliable and appropriate time to detect anything chronic, because you know some diseases are very sneaky. You cannot realize them until the time comes when they are inevitable and when they are incurable. So that's why we would like to invite everybody to the checkup programs. There is an approach, or there are some disputes about the age when we should start doing the checkup programs. So at the late of 20s and at the early 30s is the most appropriate time, as for me, because as my profession for over 35 years, I have seen that the age of cardiovascular problems, heart problems, or cerebrovascular problems, or metabolic problems just come to the age of 20s. That's why we have to be acting at that age. So late 20s and early 30s is the most appropriate time. After I see the results of the patients, then I would just figure out at what intervals I should follow the patients. If there is nothing wrong with this age group, I would call them back in every 2 years. So a biannual evaluation is perfect. But after age of 40, independent of the gender, males and females should come to the checkup program annually, every year, without exception, of course. But the tests, of course, should vary according to the problems or chronic diseases detected. So every program should be personalized. That's our motto. They are easy to assess and access, and they are affordable, I told you. And of course, I can manipulate all other physicians, specialists, according to the problems that have been detected to the people. So it's like, you know, a case managing system. And 2 things I want to focus lately. One of them is a full body MRI is strongly promoted by ourselves because it's totally dangerous and harmless. You don't get any radiation or any problem with the MRIs. And the whole body is scanned from the head down to your toes. When there is something detected or some problematic region is focused, then we will do other comprehensive tests to find out what the real problem is. It takes around 1.5 hours, but it gives valuable information for us that will affect all your life. And the second is genetic testing. You know, in 2022, the whole human genome has been decrypted. So we know all the human genome right now. And when we do the test, we will know all the problems, oncological metabolical, every kind of problem that you can face through all your life. Again, very valuable information is coming from the test. When to do the genetic test is after age of 18, 1-8 is the most appropriate time, because we have to detect as early as possible the problems. Then we will take precautions. You know, each government on the world right now is encouraging checkup programs, because when we detect something early, we spend less money and less effort, less time to prevent it from coming. But after the complications start, it's very hard for you to cope with them, both mentally and economically, of course. So the governments are in favor of doing mostly checkups. So these are the main things that I'm going to put a stress. I don't want to bore you too much, but if you have questions, I can answer them gladly. Thank you for your patience.
Thank you very much. Thank you very much. Așadar, ca un rezumat, dacă îmi permiteți, Acibadem are în prezent check-up-urile de investigații standard, cum spunea domnul doctor, și cel executiv. Ce-i de reținut este că dumnealor personalizează fiecare check-up, încep întâi cu o discuție cu pacientul, țin seama de bolile sau nu știu, de orice situație sau problemele fiecăruia și apoi personalizează check-up-ul în funcție de situația care se impune. Discuțiile referitoare la predispoziții, la testele genetice de care spunea domnul doctor, sunt un subiect interesant și dacă aveți întrebări oricând pe parcursul evenimentului, puteți să-l deranjați, să spunem așa, pe domnul doctor. E un element de noutate, spun pentru noi, nu pentru ei. Se pot afla predispoziții ale fiecăruia către un anumit tip de cancer. Dacă sunt cazuri în familie, cu siguranță trebuie să avem în vedere acest aspect, destul de important. Și de asemenea, ce mai spunea dumnealui, și e demn de reținut, este că pentru fiecare din noi, fuga asta zilnică, stresul, activitatea pe care o avem, este parcă din ce în ce mai grea și ne stresează din ce în ce mai mult. Dar timp pentru noi, parcă avem din ce în ce mai puțin. E momentul să facem din, nu știu, din noi o prioritate, să zic așa, și să ne punem sănătatea pe primul loc. Pentru că dacă nu avem sănătate, e clar că niciuna din activitățile noastre zilnice nu le mai putem desfășura așa cum trebuie. Atât noi, cât și copiii noștri, desigur, rudele noastre, toate trebuie avute în vedere să le ținem sănătoase și ori prin medicii noștri, care sunt de asemenea foarte, foarte prezenți și dispuși, și salut încă o dată prezența în această seară și a domnului doctor Crivoi și a doamnei Paciu. Suntem aici pentru fiecare și atât domnii doctori din Turcia, cât și ai noștri sunt dispuși la o colaborare. Cel mai important, sau menirea mea, cred, în toată povestea asta, este să facem cunoscută informația, accesul facil, zic eu, către o a doua opinie medicală, către acest check-up de investigații, către discuțiile între medicii noștri și medicii dumnealor și să înțelegem că, în final, cei care avem de câștigat suntem noi. Beneficiem atât noi, cât și rudele noastre, atât de informații și de tehnică de ultimă generație și e foarte, foarte important ca focusul și follow-up pe orice dosar al unui pacient să fie făcut așa cum trebuie, pentru că merităm cu toții. Vă mulțumesc. Da, vă rog.
2 zile durează o analiză completă, urbană și cu genetic testing, nu?
Da, se recomandă check-up-ul standard, se recomandă a fi făcut pe durata 2 zile, pentru că în prima zi se fac testele mai importante, analizele de sânge, toate investigațiile imagistice. A doua zi ies aceste rezultate și de asemenea se discută, inițial discutați sau se face întâlnirea cu medicul generalist, unde discutați fiecare ce, nu știu, dacă sunt ceva probleme, da? Și ulterior, la fel, pentru interpretarea analizelor, e foarte importantă discuția post-check-up.
May I cut in, please?
Yes.
So, when we do the genetic test, it's very easy to give the sample. One piece of blood and a swab from the buccal mucosa, just this. It takes 5 minutes. But the specimen, the sample, will be sent to America, our affiliated laboratories. And there's going to be a time like 3 or 4 months. After that, a book that's dedicated to your name will come. So it's around 250 or 300 pages, all relating with you and the possible problems that you're going to face in your life. You know, it's a percentage, of course, a list of percentages, and the top 10 will be rated at the first page. That's the list of diseases that you're going to face all your life, probably. So you should be focused on preventing those. And if you want, the sample that you have sent will be kept under secret conditions, of course. And if there is anything that's new with the genetic era, it can be re-evaluated by then again. And if you want, of course, it will be destroyed, and the information of destroyance will be coming to you for genetic testing. And for genetic testing, only you, the genetic doctor, and I will know. Nobody else can see the report in the system. And the probabilities or the problems that you can have will be explained to you by our genetic professor.
Da, iar check-up-ul executiv se recomandă a fi făcut pe o perioadă de 3-4 zile, tocmai pentru că include și colonoscopie și endoscopie și atunci, ca să nu fie pe fugă, mai implică anumite proceduri specifice, se recomandă 3-4 zile. Ok, vă mulțumim pentru atenție. Dacă mai sunt întrebări, vă rog.
O să... Da.
Te rog, Ana, dacă...
Vreau să întreb așa, mă gândesc că ar fi interesant. Care ar fi cele mai frecvente probleme de sănătate descoperite în timpul controalelor medicale, check-up-ului? En sık rastladığımız şeyler, nelerdir?
Bulgular yani, değil mi?
Ya, bulgular değil, hastalıklar. Yani check-up'ta keşfettiğimiz.
So, if any patient comes to us consulting and he or she has no problems, the most problem that I see is metabolic. So it's diabetes or hypertension. You know, they are very sneaky diseases and they can just start many years ago before we realize them. You know, there is a proportion who is close to medical area may know this. Half of the patients know that they are hypertensive, and half of the patients who knows they are hypertensive is under treatment. So that's a very big problem for whole world, because there are many complications related with hypertension, and when they hit you, like cerebrovascular problem, and when you are paralyzed or hemiplegic, then of course the care of the patient will be more expensive, more troublesome for the whole family or for whole society. That's why we have to cut. And for diabetes, of course, now it's you know, increasing trend of diabetes and metabolic problems arise with hyperlipidemia, like high cholesterol levels, high triglyceride levels, and besides that, of course, for males, low testosterone levels, more and more I see every day because of sitting all around. So that's going to be a problem in the future. But of course, when we do the full body MRIs, we can detect tumors. You know, in standard ones, we don't see the cranium, we don't see the extremities, but with MRI, we see the whole body. And many tumors have been detected this way. Plus, there are some arteriovenous malformations about the vascular system, which should be surgically corrected and which are life-threatening. I have seen those, but mostly, yes, cancers. Cancers are increasingly most encountered nowadays. And about the about the child, I think you have mentioned about this. So, yes, there might be some families who want to do the checkup programs for children under 16 years of age. Then the pediatric experts take over the situation and they do the tests according to their references. And they, at the end of the day, evaluate the final conclusion. But of course, for standard checkups, again, let me remind, 1 day is enough, and for executive ones, you should spare 3 or 4 days, because there'll be a sleeping test, you have to stay 1 night over the hospital, and of course, you're gonna have gastroscopy and colonoscopy, which should be prepared the night before. So you should spare at least 3 days, I'm sure.
Thank you very much.
You're welcome.
I'm sure there are people that think, okay, if I go to a doctor, so I'm afraid to go to a doctor. Do you have any advices for these
anxiety problems?
Think, okay, maybe I
myself am scared to go to a doctor too. So it's very natural and very human, of course. And many people think that when you do a test, the doctor will definitely find out something wrong. That's true. We are there to find something, and we are here to scare people. I'm joking, of course. So, of course, there are many problems, or there are many symptoms that we just overlook, like fatigue, weight loss, sweating, palpitations, nausea, vomiting, that we can encounter all the time, all the days. But some of them may be a manifestation of something more serious. That's why we are there. So we have to examine all of those symptoms according to their sources, and then we have to give a clear definition for what's happening in the body. That's why, yeah, you can be scared that the doctor will find something, but you should be there, because knowing that you are fully healthy or knowing that you have some problem that can be easily cured is, priceless. And some people may think that when I go to hospital for these tests, I'm going to suffer from pain or whatever. All the things that we do are painless. Of course, there might be some small complications when we take blood samples, or for females, of course, when we do the mammography, your breast can be pressed a little more. I think most females are scared of this test after age of 40, but we have a new machine that compresses very slightly slowly, so it's an advantage for females as well. But of course, we should take advantage of technological approaches, improvements. So everything is, as for me, harmless, why we do this test. And when you measure the pros and cons of these tests, of course, the pros are way too high.
Do we need a special preparation before checkup? I mean, the results to be the
appropriate ones. Yeah, the night before, I would like the patients to stop eating and drinking after 11 p.m. It's going to be enough for us. I don't want you to take alcohol and alcoholic beverages the day before, but all the chronic medications that you should be using regularly should be again continued. You don't need to stop the medication, never stop the medication. You can take with small bits of water before you come to the examination. And of course, you shouldn't tire yourself the night before you prepare for the checkup program. So you should be well rested. That's enough.
I don't have it.
Please, Anna.
Thank you very much again. And please enjoy the evening.
Pe parcurs, adică dacă cineva vrea să întrebe ceva în particular, domnul...
Sigur.
Sigur,
Okay.
Mulțumim mult încă o dată.
Thank you very much. Please enjoy. Nice. Thank you. Thank you.